Every single day, your body is leaving you a detailed health report, a report that most people glance at for half a second and then flush away without reading. And I am not being dramatic when I tell you that what is in that toilet bowl right now could be one of the earliest and most reliable warning signs of something serious happening inside your body, including cancer, liver problems, internal bleeding, and digestive disease, months or even years before you would feel any symptoms at all. The problem is that almost nobody knows how to read those signs until today. I am Dr. Weston, and today we are going to talk about something that most doctors never take the time to explain clearly in a standard 15-minute appointment. What your stool is actually telling you about your health. I know this is not the most comfortable topic, but in 15 years of clinical practice, I have sat across from too many patients who told me they noticed something unusual for months and assumed it was nothing. Some of those conversations were the hardest of my career. Today, I'm making sure you have the information you need to read your body's daily health report before it becomes an emergency. Before we go any further, I want you to drop a comment below right now and be honest with me. When was the last time you actually paid attention to what your stool looks like? Most people never do, and I completely understand why. But by the end of today, you are going to understand why 2 minutes of attention every day could genuinely be one of the most important health habits you ever build. And if you have ever noticed anything that seemed unusual but dismissed it as probably nothing, please add the word yes to your comment right now. Now let me start with a simple framework that is going to make everything we discuss today easy to understand and easy to remember. Because once you have this picture in your mind, you will know exactly what to look for every single day. I have a patient I want to tell you about. A lovely 66-year-old woman named Patricia who came to see me after noticing for several months that something about her digestion seemed different. Her stools had changed in shape. They were narrower than usual. She had been putting it down to changes in her diet. She had also noticed some blood on the tissue occasionally, which she assumed was from hemorrhoids. Patricia had been dismissing these signs for nearly 5 months before she finally mentioned them to me almost as an afterthought at the end of an appointment about something else entirely. When we investigated properly, what we found required prompt treatment. Patricia told me afterwards that she wished she had said something the very first week she noticed the change. Her story is not unusual, it is heartbreakingly common, and it is exactly why this conversation matters so much. Your digestive system processes everything you eat, and what comes out the other end carries a genuinely remarkable amount of information about what is happening inside your body. The color tells you about your liver, your bile ducts, and whether there is any internal bleeding. The shape and consistency reveal information about your colon, your digestive speed, and whether anything is obstructing the passage of waste. The frequency tells you whether your digestive system is functioning efficiently or whether something is slowing it down or speeding it up in ways that deserve attention. And changes from what is normal for you are often the most important signal of all. Doctors use a standard reference tool called the Bristol stool scale to describe the different forms stool can take. It runs from type 1, which is very hard separate pellets that are difficult to pass, through to type 7, which is completely liquid with no solid form at all. The ideal range is types 3 and 4, formed smooth, soft, and relatively easy to pass. That consistency tells you that your digestion is working at a good pace, not too fast and not too slow, and that your body is absorbing nutrients properly along the way. Type 1 and type 2 on the scale indicate constipation. Your intestine has been holding on to waste for too long and it is drying out. This is not just uncomfortable. Chronic constipation causes ongoing inflammation in the colon, strains the rectal veins, creating hemorrhoids, and some research suggests it may be associated with higher long-term colon health risks. If you are regularly passing very hard, difficult stools, your digestive system is telling you something important about your hydration, your fiber intake, and potentially your overall gut health. On the other end, types 6 and 7 indicate diarrhea. Your intestine is moving content through too rapidly, which means nutrients are not being absorbed properly, and your body is losing fluid and electrolytes faster than is healthy. Occasional loose stools from a meal that disagrees with you or a brief illness are completely normal. But persistent loose stools lasting more than 2 to 3 weeks deserve medical attention because they always have an underlying cause that needs to be identified and addressed. Now, here is something that is just as important as consistency and that most people never think to track: frequency. Ideally, your body should produce a complete, comfortable bowel movement every day. Some people naturally and consistently go every other day, and if that has been their lifelong pattern and they feel completely empty afterwards, that can be entirely normal for them. But when more than 2 or 3 days pass without a bowel movement, or when you notice a significant unexplained change in your usual pattern, that change is worth paying attention to. Sudden, unexplained changes in bowel frequency, whether towards more constipation or more looseness, can be associated with intestinal blockages, hormonal changes, certain medications, stress, or in some cases, more serious underlying conditions. But wait, because what I am about to tell you now is the part of today that I genuinely want you to remember above everything else. The color of your stool is one of the most important and most consistently ignored health indicators that your body produces every single day. The normal color is brown. This familiar brown comes from a substance called bile that your liver produces and that mixes with your food during digestion. Bile starts out greenish and transforms to brown as it moves through the digestive process. That familiar brown color is essentially a daily confirmation that your liver is producing bile normally, that your bile ducts are open and unobstructed, and that your digestive process is completing properly. Pro tip number 1. The simplest and most practical thing you can do to start monitoring your digestive health immediately is to take 2 seconds to look before you flush every single time. You do not need any equipment. You do not need any medical training. You just need to look 2 seconds. That is the entire habit. And that 2-second habit could be the thing that catches something important early enough to make a real difference. Green stool is usually not cause for concern. It typically means either that food is moving through your system a little faster than usual, so the bile does not have time to complete its full color transformation, or that you have eaten a significant amount of dark leafy green vegetables like spinach or kale. If you have had a very green salad, heavy meal, and your stool is green the next day, that connection is straightforward and nothing to worry about. Pale, clay-colored, or whitish stool is a different matter entirely. When stool loses its normal brown color and becomes pale or clay, like this suggests that bile is not reaching the intestine properly. Bile gives stool its color, and if that color is absent, it means the bile ducts may be blocked or that the liver or pancreas is not producing or releasing bile the way it should be. Pale stool that persists for more than 2 or 3 days deserves prompt medical evaluation. It can be associated with bile duct obstruction, liver concerns, or pancreatic issues. This is not something to watch and wait on for weeks. Tell me in the comments right now, have you ever noticed your stool being an unusual color and dismissed it or waited a long time before mentioning it to your doctor? I genuinely want to know because your honesty might encourage someone else watching to act faster than they otherwise would. Now, let me talk about the 2 color changes that represent genuine medical urgency. And I want you to hear this clearly because these are signs that should never be ignored or explained away. Black tarry stool is one of the most serious signs your digestive system can produce. When stool appears very dark black with a thick tarry consistency and sometimes an unusually strong odor, this is called melena, and it indicates significant bleeding somewhere in the upper digestive tract, your stomach or your small intestine. The blood that is causing this color has been digested as it traveled through your system, which is what gives it that characteristic dark tarry appearance rather than remaining red. This type of bleeding can be caused by a bleeding stomach ulcer, damaged blood vessels in the digestive tract, or in some cases internal bleeding from a tumor. Black tarry stool is a medical emergency. It means there is active bleeding happening inside your body right now. If you ever see this, please do not wait until morning. Do not tell yourself it is probably nothing. Go to an emergency department or call your doctor immediately if it is during office hours. I have worked with patients who delayed seeking care for this sign, and by the time they came in, they required urgent intervention that could have been less complex if they had come sooner. Please do not be in that position. Bright red blood is the second urgent color warning. Bright red blood on the toilet paper, coating the outside of the stool or mixed throughout the stool, indicates bleeding from the lower part of the digestive tract, the colon, or the rectum. Sometimes this is caused by hemorrhoids or a small anal fissure, which are relatively minor causes. But bright red blood can also indicate polyps growing inside the colon, inflammatory bowel conditions, or in some cases colorectal cancer that is actively bleeding. The critical point here is this: you cannot determine the cause of rectal bleeding by looking at it. Even doctors cannot make that determination without a proper examination. Every episode of rectal bleeding deserves medical evaluation. Please do not assume it is just hemorrhoids and dismiss it. Get it properly checked. Pro tip number 2, if you notice any blood associated with your bowel movements, take note of exactly what you saw before your appointment. Was the blood bright red or dark? Was it on the paper only or mixed into the stool or coating the stool? Did you have any pain? Did you notice any change in your stool shape or consistency at the same time? This specific information helps your doctor significantly in understanding what may be happening and what investigations are most appropriate. Now let us talk about shape, because shape carries genuinely important information that most people have never been told to look for. Normal stools should be roughly cylindrical and comfortable to pass, somewhere in the range of a banana in diameter. When stool is consistently coming out narrow, thin or pencil like this can suggest that something is partially narrowing the passageway in the colon. This narrowing could be caused by chronic muscle tension, by inflammatory changes, by the presence of diverticula, which are small pouches in the colon wall, or in more serious cases by a growth that is partially obstructing the passage of waste. Thin pencil-like stools that appear occasionally after an unusual meal or a period of stress are less concerning than thin stools that appear consistently over days and weeks, especially if this represents a change from your normal pattern. A persistent change in stool shape that lasts more than a week or two deserves medical attention. The sensation of emptying is also worth paying attention to. After a complete healthy bowel movement, you should feel a clear sense of relief and completion. If you regularly feel as though you have not fully emptied even after spending considerable time in the bathroom, or if you feel a persistent urge to go throughout the day even after a recent bowel movement, your digestive system may be experiencing inflammation, incomplete emptying, or another underlying issue that warrants discussion with your doctor. Now, let me share 3 genuinely practical strategies for supporting your digestive health starting today, because information about warning signs is only half of what you need. The other half is knowing what to actively do to keep your digestive system as healthy as possible. The first strategy is daily movement. Your colon depends on physical movement to function properly. When you sit or lie down for the majority of the day, the natural muscular contractions that move waste through your colon slow down significantly. A 30-minute walk every single day is one of the most consistently beneficial habits you can build for digestive health. It does not need to be vigorous. A brisk, comfortable walk is sufficient. If 30 minutes feels like too much right now, start with 15 minutes and build up gradually. The important thing is that it becomes a daily non-negotiable rather than an occasional activity. Pro tip number 3, walk after meals whenever you can. Some research suggests that a 15 to 20-minute walk after eating may help support healthy digestive motility and more stable blood sugar responses after meals. Both of those benefits are genuinely valuable for overall digestive and metabolic health. It is a simple habit that stacks 2 significant benefits into one short daily walk. The second strategy is supporting your gut microbiome. Inside your digestive system lives a vast and complex community of microorganisms, bacteria, fungi, and other tiny life forms that collectively play an enormous role in your overall health. When this community is healthy and balanced, it supports efficient digestion, produces important vitamins, regulates your immune system, which is primarily housed in the gut, and even influences your mood and mental clarity. When this community becomes imbalanced through poor diet, overuse of antibiotics, chronic stress, or insufficient fiber, the downstream effects can include digestive irregularity, increased inflammation, reduced immune function, and changes in energy and mental well-being. The most effective way to support a healthy gut microbiome through food is twofold. First, include probiotic-rich foods that introduce beneficial live bacteria directly. These include plain, unsweetened yogurt with live active cultures, kefir, which is a fermented milk drink with an even wider variety of beneficial bacteria than yogurt, fermented vegetables like traditional sauerkraut and kimchi, and fermented drinks like kombucha. Aim to include at least one serving of fermented food in your daily eating. Second, include prebiotic-rich foods that feed and nourish the beneficial bacteria already living in your gut. Prebiotics are specific types of fiber that your own digestive enzymes cannot break down, but that your gut bacteria thrive on. Good prebiotic food sources include slightly underripe bananas, apples eaten with the skin, whole oats, onions, garlic, leeks, asparagus, and a wide variety of colorful vegetables. These are not expensive or complicated foods. They are everyday whole foods that humans have been eating for thousands of years and that your gut bacteria are perfectly designed to use. One important note about antibiotics: they are genuinely life-saving when used appropriately for bacterial infections, but they affect the gut microbiome significantly by killing beneficial bacteria alongside harmful ones. Recovery of a healthy gut community after a course of antibiotics can take weeks to months. This does not mean avoiding antibiotics when they are truly needed. It means not taking them for viral illnesses like colds and flu, where they have no effect. And it means actively supporting your gut through fermented foods and fiber-rich eating during and after any necessary course of antibiotics. The third strategy is daily hydration with intention. Your colon needs adequate water to keep waste moving through it at a healthy pace and to form stool with the right consistency. Chronic mild dehydration is one of the most common and most easily overlooked contributors to constipation in older adults. The thirst mechanism becomes less reliable as we age, which means you can be genuinely dehydrated without feeling particularly thirsty. Drinking a full glass of plain water first thing in the morning before coffee or food helps activate your digestive system after the overnight fasting period. Continuing to drink water consistently through the day rather than in large amounts all at once gives your colon the steady supply it needs. Including fruits and vegetables with high water content like cucumbers, celery, watermelon, and leafy greens also contributes meaningfully to your daily hydration. Adding fiber gradually to your diet alongside that increased water is an important paired habit. Fiber without adequate water can actually worsen constipation because fiber absorbs water as it moves through the colon. Adding chia seeds or ground flaxseed to your morning yogurt or porridge, choosing fruits with skins, and increasing vegetables across your meals are practical daily ways to build your fiber intake without drastic dietary changes. Let me now bring everything together with a clear action plan you can begin implementing today. Tonight before bed, take 2 minutes to think back over your recent bathroom visits. Have you noticed any changes in consistency, color, or frequency from what is normal for you? Have you noticed any blood? Have you noticed any changes in shape? Write down anything that has seemed different recently and bring it to your next doctor's appointment. Starting tomorrow morning, drink a full glass of plain water before anything else. Then go for a walk of at least 15 minutes. Include 1 serving of fermented food in your day. Add some fiber to at least 1 meal. These 4 habits together form the foundation of genuinely supportive daily digestive care. If you notice black tarry stool or any bright red blood associated with your bowel movements, please seek medical attention promptly. Do not wait and watch. If you notice any significant persistent change in your normal bowel pattern, shape, or color that lasts more than 1 to 2 weeks, please discuss it with your doctor. Your digestive system is connected to your immune health, your energy, your mental clarity, your cardiovascular health, and your long-term disease risk in ways that most people never fully appreciate. Taking 2 seconds to look before you flush every day and building these simple daily habits is one of the most genuinely powerful things you can do for your overall health. and it costs nothing. In my next video, I am going to talk about 5 specific foods that some research suggests may actively support colon health and digestive function in adults over 60. You are not going to want to miss that one, so please make sure you are subscribed and have your notification bell turned on. If this gave you something genuinely valuable today, please share it with someone you care about, a family member or a close friend who might benefit from understanding these signs. That share could make a real difference. Remember, this video is for informational and educational purposes only. Always consult with your personal doctor before making any changes to your health. If you found this video helpful, don't forget to subscribe to the channel and hit the notification bell so you never miss a health tip. See you in the next video.